World over, the year 2020 cannot be hurriedly forgotten. This is due to the COVID-19 pandemic that took over the centerpiece of global attention and rendered the world helpless in the midst of crumbling economy and human lives. The aftermath of the above prompted the World Bank to introduce the Nigeria COVID-19 Action Recovery Economic Stimulus (Fct-Cares) with state branches and the FCT. Fct-Cares has 4 delivery platforms, namely DLI 1.1, which is in charge of social transfer for the aged, chronically ill and disabled; DLI 1.2, labor-intensive public warfare; DLI 1.3, livelihood support for economically active individuals; DLI 1.4, basic infrastructural services to communities. FCT Community and Social Development Project (Csdp) is the flagship project that provides grants for human capital development of communities and vulnerable groups to enable them to embark on various development agenda. The project employs community-driven development approach (CDD) in deploying the project resources for social and natural resource infrastructure services to benefiting communities and vulnerable groups. Fct-Csdp is the agency responsible for the implementation of DLI 1.2 and 1.4 in the nation's capital, and it took the needed steps in identifying areas to inject the stimulus in rebuilding the economy of the territory. The implementation and execution are spread across various areas and spheres such as health, education, and water, among others. DLI 1.2 is the platform for engaging community members to provide social services within their immediate environment, while DLI 1.4 focuses on the provision of social basic infrastructure facilities. A visit to various communities across the FCT explains it all. Water is a necessity for day-to-day activities, and communities across the FCT are happy with the provisions made.
It's a joy to the community because we have never had it good like this before. So with this development, I think we are very, very okay. It's just because it rains today. That's why I cannot see women here. Assuming it has not rained, you would have seen a lot of women here fetching water. This water is helping a lot. In fact, it was terrible. Because people have to cross this road to the other side to fetch well. They have to go cross the road to go and fetch well in the other side of the community.
Rafi okiya waje na muke diba ruwa da. To da muka yi kuka sai aka ba mu bawa din, yanzu muna jin dadin ruwa. Mun gode Csdp.
Before we are going river to do line by force the water will finish in the river self. But now we get water, we have borehole in the area. Thank you.
Our children are schooling or learning under trees before, but to the intervention of Fct-Cares, now the community has our purpose are now learning inside class, which the environment is very good, conducive for our children to learn now. So all what we have is to give thanks to Fct-Cares for intervening to community problems.
Our children, they normally go to Naharati Sabo Primary School, although it's far from here. But now, as this new primary school was existing now, although our children the school is very close to our community here.
The health deficit had become worrisome until this intervention, which has boosted the hope of many.
Most places, if there's no accommodation, they won't post staff to such places. So we now discussed with the community leaders and said, okay, this is our need. How do we go about it? We now looked at that place and said, okay, let's convert this place to a residential place so that it will now be useful for our staff. And they contacted Csdp, which they came and did a feasibility studies of the place and saw it that it would be good for us to convert it, and they did it. Within a very short period, that was done. And immediately they handed over the project to us. All the rooms are occupied.
Prior to this moment, the facility does not have where staff can come and spend the whole night in case of patients who are coming in the night, especially those coming for delivery and some related issues like that. But unfortunately, because those staffs are not around, we will not be able to access such services. But as we speak, even if you go to the quarters now, you will see different health professionals who are resident here, such that if you come here at any time of the day, you will be able to meet them to attend to us.
For the renovation is okay. Preferably, we like the renovation more than before.
The CSDP Fct-Cares came in a different ways. One, they renovated, as you can see, they renovated a very big geriatric hospital in our community, sited in our community, and rehabilitation of boreholes, provision of a school desk, and even renovation of staff quarters was among those projects embarked by the CSDP in this community, Fct-Cares in this community. And by grace of God, we are happy for the interventions.
Ada lokacin asibiti namu wannan da bai kyau ba, amma yanzu ya yi kyau. Ada lokacin asibiti namu mutane ba sa zuwa, lokacin muna zuwa a gada biyu ne, amma yanzu ya yi kyau. Ga kujera kuma da an kawo mana mun gode kuma ya yi kyau. Jama'a Fct-Cares.
Education is the bedrock of any society. This was not left unattended to, as many classrooms were built, while some were renovated and learning materials made available by FCT-CSDP.
But I feel elated. I'm glad. I'm glad because my children will have somewhere to learn, and my teachers will have a good environment to teach. In fact, we are borrowing classes from UBEB, and we made a batcha when we discovered that the classes given to us were not enough. They were very inadequate. So we have to make extension, and that is the extension you are seeing there. And sincerely speaking, having this will boost the ego of my students and the teachers.
I feel happy to see how they come assist the community, because since when we have the senior secondary school, there's no classroom for the pupils. They are using bacha, even bacha you are seeing here is for their class. So we are happy to have them come and assist us in this community.
In fact, before the renovation of this classroom, what normally happened, the children will come to school. Before it is hot sun, the teacher has to send them off. Or at times, if it is rainy season, when they are seeing the cloud becoming rainy, they have to send them home. But with the coming of, with the intervention of the Fct-Cares, the children stay their normal learning hours in the school. We are very happy. We pledge and ask that government should continue to support this kind of project. For now, the learning environment is conducive.
Unemployment is a cankerworm that is eating deep into the economy, hence the introduction of labor-intensive public workfare. Our lens captured many engaged in various communities.
If you go down through the court road towards the abattoir, you understand that most of the time that drainage is always blocked, because once it's raining season like this, people dump their refuse in the drainage, and once that place gets blocked, we experience flooding, which is not always good. But with our youth cleaning up that place, you can agree with me that that place now is no longer experiencing flooding and other things. And let's not forget that cleanliness is next to godliness. Any environment that is not clean, it is not habitable for anyone to live.
And with the help of this program, I was able to establish a small-scale business that helped me a lot. We peel granules, we buy granules, we store them. At the same time, we peel and take them to the market for sale. We sell all this perfume. We make perfume. There are some of us that make this kuli, a product of granite. There are some of us that do different business with the help of this program. So we are so happy with this program. Thank you very, very much to Fct-Cares. Thank you, Federal Republic of Nigeria. Thank you, FCT administration, because we are so happy with this program. Without you, Fct-Cares, our community will not be have this development that we are having presently.
It has helped me and my family in different ways, because I was indoor doing nothing till this beneficiary come up. I benefit a lot. I was not be able to start a business, but now I'm into a business due to this beneficiary now. It has already, in fact, it has done many things in my life and the life of some of our members here. We soup Caro Primary Health Center. From there, this palace here, New Chi Palace, we come out 3 times, 4 times in a week to sweep the environment. And as you can see, the environment is very clean.
My community and my group member, they are very happy, and the work we are really doing the work perfectly, and the environment where we are working, everybody appreciating, everybody are congratulating what we are doing. They really welcome us wherever we are going and whatever we are doing.
Ni ina cikin wanda suka yi beneficial ne LIPW. Ina cikin wanda Allah ya zaba a cikin su. To gaskiya mun gode Allah, because program din gaskiya wallahi muna achieving sosai. Ba ma yin komai a da, amma sanadiyar LIPW gaskiya ina sai da chako na shago na ma yanzu nan. Ina sai da manja ma a cikin gida. Gashi nan ɗaurin naira da rike na kan da nake ɗorawa. An kuma sanadiyan LIPW shine muka samu ci gaba din nan, and we are very happy for this program.
Social Development Project is a community-based agency which is funded by the World Bank to support the government in providing social services to the vulnerables.
We only implement projects that are really needed by the community themselves. We don't impose projects onto the community. The community initiate the project themselves, they implement themselves, and they utilize it themselves. So in that point, you see that the community itself is empowered, because from the initiation, the implementation, the community are involved. So that will make them happy, and you can see joy in their faces, because they are involved in the implementation. And it is also a means of empowering them. Some of them who are unemployed, we find themselves there also getting some income in the process of the implementation. So that makes them happy. And we also, when we see them happy, we are also happy, because we know that they are happy.
Following the devastation of COVID-19 disasters, FCT was not left out, and when the federal government and the World Bank decided to intervene financially and by providing resources to states, through the Fct-Cares program, it was a very welcome development, honestly. The economy of the country was in tatters. For a very long time, people couldn't go out. There was no productive activities going on. So a lot was lost during the COVID-19 disaster. So there was this pressing need for intervention from all sources, and it was good that this financial intervention came up.
See, you can see the pocket of a project across the FCT. You can see even the remote areas. If you go, you see one CSDP project or another. In fact, I was driving through Caro So I saw one tank, that is borehole. I was showing my friend that, look at this, is one of our projects. So it's very, in fact, it gave me a great pleasure that I can, whenever I move around, I can see the impact of the macro projects by the FCT Community Social Development Project.
What we do is we go for sensitization, advocacy and sensitization visit to various communities, all communities. Depending on how we strategize, we could decide to go to chiefdoms, community to community, maybe area council by area council, to sensitize them on what CSDP is all about. So from there, every community that hears about CSDP now sends in expression of interest to the office. We now look at the expression of interest based on the needs of the communities.
We want to make the people in the community smile. We want to help them get relieved from the effect of the COVID-19 pandemic in the lives of people. We also want to keep them afloat because these ones are chosen from the vulnerable household. There are people who are not employed, so we want to get them back on the workforce so that they will be able to take care of themselves and feed their family.
We do follow up and get feedback, feedbacks from the community to our stakeholders. So we tend to see the perception, and I'm bold to tell you that the perception is high. They are very happy. They are the ones in the driver's seat. All we do is we support them, capacity building, things like bookkeeping, how to do mini procurement processes, which I know it's moving very well. Part of the MIE where we go out is we also sensitize them. There's also a sustainability plan of how they will take care of those things, and so far they've been doing it.
With this intervention, FCT communities can now have a fresh breath of social amenities as well as regain their livelihood, which will in turn boost the economy of the nation.